Hello, in this video, let us look at DapaGliFloZin. DapaGliFloZin. So this is a very famous anti-diabetic drug orally taken. It is very famous now. You can see that everybody's talking about it. DapaGliFloZin. It is coming under sodium glucose cotransport 2 inhibitor, that is SGLT2 inhibitor. It is coming under miscellaneous drug. Oral anti-diabetic drug. So basically, what is it doing? It is going to get the glucose out via your renal system. Get the glucose out. So reabsorption of glucose, I think it is stopping, something like that. Let's read about it. So why should you know this drug? Because it is now very, very famous. So the latest KD Tripathi covers DapaGliFloZin, okay, in its highlights in the 9th edition. So DapaGliFloZin is very, very good. So they are saying it's protecting the heart and all that. So they like it. So let's look at this. Earlier version of KD Tripathi won't give you that much information. So let us look at the latest to 9th edition information on DapaGliFloZin. So look at this DapaGliFloZin. It comes as 10 mg. Looks like, right? Did you observe that? 10 mg, right? DapaGliFloZin tablet 10 mg. Okay, this is oral. So DapaGliFloZin is an oral anti-diabetic drug for type 2 diabetes. It is also used to treat heart failure because it has protective action on the heart. So DapaGliFloZin, this is the classification. Here you can see sodium glucose cotransport 2 inhibitor, SGLT2 inhibitor. So it will stop the reabsorption of glucose. So a lot of glucose will go away, which it has been filtered by the kidney, go away. So basically what is happening, all the glucose the kidney is removing. So there's a lot of glucose here, right? All that the kidney is removing. This SGLT2 guy, what he was doing, he was reabsorbing this glucose. SGLT2 guy was reabsorbing this filtered glucose. So now what are you doing? You are banning that SGLT2 guy. SGLT you are banning. So what will happen? The glucose is going down here in your urine. It cannot, not much of it will be absorbed back. So all the glucose is going in the urine, which is kind of good for you, right? You want to get rid of the glucose. So what happens? Glucose in urine, that's all you remember. Basically, whatever is filtered, you're inhibiting the reabsorption. So what will it cause? It will cause glycosuria or glucouria. Glycosuria means it refers to many sugars like glucose. Glucouria refers to specifically glucose, okay? So glucose loss in urine, and what will happen? Lower blood sugar levels, which is good for you. That's what you want, right? So what are we reading? DapaGliFloZin. Okay. So now, what and all are you using it for? Come on, say. You're using it to treat diabetes, and also you can also use it to treat heart problems, heart failure also you can try to treat. In fact, it has a protective effect, right? So before these people go into heart failure also you can give. That's what they're trying to say. So you're using it for type 2 diabetes, not type 1, remember. And even if the patient has hypertension, heart failure, or even kidney disease, chronic kidney disease, then you can give mild to moderate. They're not saying severe, because the kidney has to filter, right? Then only this will work. So it also protects the kidney, they are saying. I don't understand how. Beneficial effect on kidney disease, heart failure, and other CVD. Okay. So did you understand? It is protecting even the kidney, even your heart, even your diabetes it is bringing under control. How is it protecting kidney? Because I think in diabetic patients you have nephropathy, right? Microalbuminuria and all you're testing for. So diabetes can damage your kidney. So I think by lowering diabetes, you're protecting the kidney. What else can be the effect? I mean, what else is the beneficial effect on kidney? Okay. Let's go down and see. Adverse effects, they are already talking about adverse effects here. DapaGliFloZin. So adverse effects, standard things that you will write, nausea, allergic reaction. So ignore that. It will cause glucosuria. sorry, glucosuria I said there, it is glucosuria. There are so many terms, glycosuria, glucosuria, okay. Then, that is what it is supposed to do, by the way, okay. So that is also an adverse effect. Patient will come with the report saying my glucose, my urine has so much glucose. So do I have high glucose level? So that they may ask, so you should be aware of it. Frequent urination, obviously you're asking the kidney to throw out the glucose. Thirst, why will they have thirst? They are losing so much of thirst only, right? Yeah, thirst. Because they are losing sodium. Look at this diagram here, filtered glucose. That means the tubules, the kidney has removed this glucose. Okay. So somewhere here, is going to be your urine, right? The filtered glucose is there here. Now this SGLT2, what it was doing, it is absorbing this glucose back into our system, right? It's absorbing glucose back. It is also it's also taking sodium in. But now we are inhibiting this. So what will happen? The sodium and glucose both are getting lost in the urine. That's what it looks like to me from this diagram. So you understood, right? Glucose is going in your urine, even sodium is going. If sodium goes, behind it, who will go? Water will go. So if water will go, then what will happen? You will feel thirsty, right? Then let us look at this. You will feel thirsty and then you will be dehydrated. And because you're dehydrated, you will become hypotensive because the blood volume will become less. And then because of hypotension, you will have little less blood flow to the brain. You'll get dizziness. All these are what I'm saying, adverse effects, okay? And then now what is happening? All this sodium is going out of your body. So electrolyte imbalance. Because of this dehydration, I'm thinking they're saying it is ketoacidosis can happen, right? Then everything is flowing very nicely. So now because there is glucosuria, there can be a urinary tract infection, genital fungal infection, that is vaginal fungal infection, especially that's what they are saying, female, right? So that's why vaginal, because glucose is there, right, in the urine. Then long term, what can happen? Bone mineral density can reduce. So again, this you should think about patients who have postmenopausal osteoporosis, etc. Right? Then, is this clear? So long term, what will happen? Bone mineral density will reduce. Otherwise, all standard things which are flowing for you. Glucosuria, so urine will have glucose, so you will have infection, so you will have sodium depletion, so you will have dehydration, thirst, hypotension, etc., electrolyte imbalance, etc., etc. Okay. Okay. Then contraindication, DapaGliFloZin, they are saying you should not use because if the glomerular filtration rate is less than 645 milliliter per minute, kidney should be working. Mild to moderate disease is fine. What is GFR? GFR is glomerular filtration rate, but what is E? Estimated glomerular filtration rate. So it seems to go from 0 to 120, and if it is less than 45, then you don't give. So this is the red zone actually. Less. This side is less. Okay. This side is more. Green and good. So if it is less than 45, don't give, they are saying. Somewhere here, if it is there, don't give. Okay. And if it is somewhere here in this zone also, they are saying adjust the dose and all that. Okay. So basically, you're using the kidneys to throw out the glucose. Take a recap now. So what are we looking at? DapaGliFloZin. It is an oral anti-diabetic drug for type 2 diabetes, and it can also be used to treat heart failure. So it makes a very good combination for patients who are suffering from diabetes and some kind of heart failure, even as a protective effect for the heart. So here you can see oral anti-diabetic drugs, right? And here you have DapaGliFloZin. So it is a SGLT2 inhibitor, that is sodium glucose transport 2 inhibitor. It makes sure that the kidney, whichever kidney you have here, it is going to remove the glucose from the body, right? So it is going to take the blood in and it's going to remove the glucose in the form of urine. So basically what was happening, this glucose was being reabsorbed into the body by SGLT2. So this reabsorption is being inhibited now. Okay. So that is what is the work of this. So glucose will easily go in your urine. Like DapaGliFloZin, you have canagliflozin, empagliflozin, ertugliflozin. Okay. So It is going to cause glycosuria. Okay. That is many types of sugars in your urine, or if you say glucosuria, glucose in urine. So that will lower the levels of blood sugar. So you can also use it to treat heart failure, even chronic kidney disease, mild to moderate. It has a beneficial effect on kidney, heart, and other cardiovascular diseases. So it has a protective effect. That is why in the latest edition in KD Tripathi, he is talking here about DapaGliFloZin, okay, in the 9th edition. So here are the tablets, 10 mg DapaGliFloZin, okay, 10 mg. Here is some representation of how it protects the heart. Okay. Now what exactly is happening here? Here is your urine. Here's the urine, right? The SGLT2 was reabsorbing this glucose, but now we will inhibit this SGLT2. So glucose will continue on its way to the urine. Okay. So that is what SGLT2 does. Here you can see even sodium won't be reabsorbed. So what will happen? Sodium depletion also can happen. So adverse effects, standard things, nausea, allergic reactions, the hypersensitivity, you will write all that. Basically, it will cause glucosuria. You know that. Glucose in your urine. So what will happen if glucose goes in the urine? Yeah, you will have sodium depletion also. So if sodium depletion happens, you will have electrolyte imbalance, right? Also, what will happen if glucose is there in the urine? You will have some urinary tract infection. You can have genital fungal infection. They're not talking about the vaginal bacterial infection. They're talking more about the fungal infection, especially in women. Then, because so much of you're trying to get glucose out, right? Frequent urination, thirst, you're losing all the fluid, remember, because sodium is leaving, even water is leaving. So you can have dehydration, ketoacidosis, because there is less water, dehydration, the blood volume will reduce. So hypotension, dizziness, because there will be a little less blood supply to the brain. That's what I'm thinking, right? And in the long term, it can cause bone mineral density loss, reduction, decrease in bone mineral density. Okay. Contraindication, you should not use if the estimated glomerular filtration rate is less than 45. So that is somewhere around here. So if it is less than this, if it is somewhere here, all this you should not give. Okay, less than 45 you should not give. If it is somewhere here you can give, and somewhere here you should reduce the dose or something. Okay, or you should adjust the dose. So this is about DapaGliFloZin. Bye bye.